Welcome to this video on what is RSV. Today we'll talk about what you always wanted to know about RSV. First, let me introduce myself. My name is Lieke de Frankrijker and I work as a pediatrician and infectious disease specialist at the Wilhelmina Children's Hospital in Utrecht in the Netherlands. I did a PhD on interaction between RSV and bacteria, especially in cystic fibrosis patients. Other than being a doctor, I am also a mother. These are my twins, Seth and Jonas. They were born prematurely, but they are now almost as tall as I am at the age of 6.5. So we'll talk about RSV. What is RSV? RSV stands for respiratory syncytial virus. It is a virus that affects the airways, and with the airways we mean the nose, the throat and the lungs. How does it work? How do people become infected with RSV, and what happens when the virus enters the body? First of all, RSV will attach to the airway cells to infect them. How does that happen? RSV will enter through the airways, for instance the nose or the throat, and then the virus will attach to the cells on the airway surface. Then the virus will enter the cell where it will replicate, which will lead to swelling of the airways by creating more slime, for instance, and also the airways will become narrow. We'll go into detail in the next picture. So first of all, you see the virus particle. It will enter through the nose or the mouth, like I said, and it will either stay in the upper airways or go down to the lower airways, which is the lungs. So this is a virus particle attaching to the cell on the airway surface and going into the cell. And once it is inside the cell, it will replicate, and this will lead the cells to swell, and sometimes the body can destroy the cells. And once the cells are swollen, they will fuse together, which will lead to syncytia formation. And that is why it is called the respiratory syncytial virus. With this active infection going on, it will produce more slime with all sorts of immune cells gathering to the airways. And also the airways themselves will become more swollen. You can imagine that with this swelling and with all the slime, the airways will become more narrow. And this is especially a problem in young babies who have narrow airways to begin with. But how does the virus spread? We know that RSV is highly contagious. It will spread through droplets, for instance, when somebody speaks or coughs or sneezes. And we also know that the virus can remain active on surfaces like, for instance, tabletops or doorknobs. And you can only imagine how rapid the virus will be able to spread in places where there are lots of people or lots of children, especially, for instance, schools or childcare centers. So what are the risk factors? First, I'd like to talk about the factors that increase a risk of a person becoming infected with RSV. Firstly, this is being born right before or during the RSV season. So for instance, if a person is born between August and February. And secondly, when somebody has siblings in school or daycare. But there are also risk factors that will increase a person's risk of becoming severely ill from RSV. And this is especially the case for premature babies, so babies who are born before 37 weeks of gestation. Also infants with chronic lung disease, so for instance those with bronchopulmonary dysplasia or with cystic fibrosis, are at an increased risk of getting severely ill. This is also the case for children with Down syndrome or for those with neuromuscular disorder, because they are less able to cough up any slime that is produced by the infection. So when does RSV occur? We'll talk about seasonality now. So we know that in temperate climates, RSV will especially peak from late autumn through early spring. But we also know that in tropical climates, RSV might be around the entire year or sometimes only during the rainy season. After the COVID-19 pandemic, however, we saw a different pattern. So for a couple of years, we saw RSV outbreaks during the summertime, where we would normally only see those during the wintertime. But finally, since maybe 1 or 2 years, the pattern seems to have been normalized again. So it has returned to how it was before the COVID-19 pandemic. Thanks very much for your attention.